Hello, my name is Ryan Hogan. I am the Luzerne and Wyoming County Single County Authority Administrator. Today, we plan to discuss drug and alcohol screening, drug and alcohol assessment, and drug and alcohol coordination of services, including placement and treatment services, and how to navigate that system. First, let's talk about navigating the system, the screening component. The goal of an initial screening is to identify emergent care needs, including any psychiatric issues that may be presenting or any major medical issues that may be presenting at the time. Our goal there is to make sure that the person's needs are being met and that there are no issues that would interfere with our placement in drug and alcohol treatment. Our second goal of a screening is to motivate and refer a client for a level of care assessment. A level of care assessment will gather histories and will determine what level of care is most appropriate for an individual. Our third goal is to identify priority populations, and we will discuss what those priority populations are shortly. Keep in mind that all screenings can be done in person or by phone by any licensed drug and alcohol facility. So we discussed emergent care needs. When we discussed emergent care, there are three components to it. Withdrawal management, which most people would commonly refer to as a need to detox. There are two ways you could detox. You could actually detox to a drug and alcohol detox facility, or you can begin a medically assisted treatment program. We keep our eye out for prenatal care. So we look for priority populations. We focus on our pregnant women and women with children, but we really do screen for any prenatal care before placing somebody in inpatient or outpatient treatment services. And as I mentioned earlier, psychiatric care. It's important to denote whether or not somebody is having any psychiatric episodes that may need different attention than placing somebody in a drug and alcohol treatment facility. Again, I note if an individual is identified as needing withdrawal management at time of the screening, the individual must be offered admission within 24 hours to either a detox offering withdrawal management treatment program or to an MAT program, medically assisted treatment. Again, our screening also focuses on priority populations as noted on the screen. Our priority populations, as denoted by the Department of Drug and Alcohol Programs in Pennsylvania, identifies pregnant women, women with children, injection drug users, overdose survivors, and veterans of the military. Evaluation and assessment. The evaluation and assessment is a gathering of clinical and non-clinical information which is used to determine the most appropriate level of care and any additional non-treatment needs that may impact placement and the recovery process. A drug and alcohol evaluation can vary in length and could be anywhere from 1 hour to 2 hours. All evaluations and assessments are expected to be completed in one session. If you run into a situation where your evaluation and assessment is broken up, please note that that is not appropriate, and all evaluations and assessments should be done in one clinical sit-down setting. A level of care assessment must be completed within 7 calendar days from the date of initial contact with the individual. Once you complete a screening, you should have that assessment done within 7 days. The level of care assessment must be completed in its entirety in one session through a face-to-face in-person interview. Level of care assessments and evaluations are not to be done via telephone unless properly noted by the provider and the level of care done by DDAP and approved by DDAP. Each evaluation assessment is valid for a period of up to 6 months. A comprehensive evaluation and assessment captures all medical history, emotional history, social history, occupational history, educational history, and family history. Many of the approved evaluation and assessment tools will encompass other areas, but must encompass these 6 denoted areas. At this time, I'd like to share some of the available treatment services in Luzerne and Wyoming counties, but also in some of our neighboring counties, including Lackawanna County. As you can see, we have a number of contracted outpatient, inpatient, and medically assisted treatment providers that can offer a variety of services and levels of care. When in doubt, I encourage everybody to call 211 for further information. Want to speak to someone now? If you are someone in need, please call 211. Thank you.